first step towards change is awareness. With this, I would like to introduce our study titled Assessment of Perception about Oral Habits in Children Among Healthcare Professionals. Preservation of oral health cannot be achieved without creating awareness. Review of literature on oral habits among children reveal wide range of prevalences existing among different populations ranging from 30% to 60%. Some oral habits can be viewed as normal for a specific age group. However, if they are continued for longer duration, they may cause several dentoalveolar problems as well as skeletal deformations. Children with parafunctional habits are reported to have higher anxiety and depression rates. Also, children subjected to stressful life events are more likely to perform oral habits. The etiology, prevalence, adverse effect, and management of such habits have been studied in the past, but little attention has been paid to healthcare professionals' attitude towards these habits, which is an important point to consider in elimination of these habits. To improve public awareness, we must first determine the present level of knowledge. And thus, the aim of our study was to assess the knowledge, attitude, and practices of healthcare professionals regarding oral habits. The methodology followed in our study was a cross-sectional questionnaire study. The required sample size of 3 to 6 was calculated using previous studies and standard sample size calculating formula. Ethical clearance was obtained and a pilot study was conducted among 20 subjects. Interns, postgraduate students, faculty, and practicing professionals from the field of medical, nursing, Ayurveda, homeopathy, and physiotherapy were included in the study. There were no dropouts in the study as all participants returned a completely filled questionnaire. Majority of the respondents were females and mean age of the population hovered around 27 years. The participants were posed with a wide array of questions that tried evaluating their awareness level. Among all respondents, 50% were unaware about the influence of peer groups and siblings on oral habits. Only 41.25% of respondents had the knowledge about the effect of intensity, frequency, and duration of performing such habits on the severity of malocclusion. Merely 26.5% of respondents were aware about the correct age for intervention and the psychological impact of early intervention in a young child. Moreover, a whopping 59.75% of respondents believed that putting social pressure can help a child break out of the habit. But on a brighter side, a good number of respondents were aware about the significance of emotional well-being of the child and how that can potentially affect the occurrence of such habits. Majority of the respondents believed that initiatives such as parental counseling and web-based education can go a long way in prevention of such habits. Also, 82.75% of respondents agreed that referral of such patients to pediatric dentists should be advocated. An important finding of our study was that professionals aged above 51 years had better knowledge than the others. It was also observed that faculty were the most aware amongst all, and thus the results emphasize on the need to spread awareness among youngsters, since young generation are the future of our country, and if we start with them, the future will be in good hands for generations to come. A multidisciplinary approach is the need of the hour, as healthcare professionals have the potential to promote oral health by encouraging regular dental visits, by participating in activities related to oral health promotion, and by acting as a role model for patients, friends, families, and communities as well. The findings from our study will be helpful in recommending the respective governing bodies to include oral habits in their curriculum and to train the budding healthcare professionals that will help in reducing its prevalence. There is also a need to conduct more such studies to serve the purpose of educating the masses and to create awareness towards a healthy lifestyle. However, the limitation of our study was that it could have been conducted over a larger geographical area with a larger sample size. Also, in future the questionnaire can be aimed for clinicians, postgraduate students and interns individually. I would like to quote John F. Kennedy in the end that children are the world's most valuable resource and its best hope for future. Thank you.